Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about diabetic gastroparesis. We're going to see what is diabetic gastroparesis is, what are the symptoms of it, causes, complications, test, treatment, and precautions. So let's get started. What is diabetic gastroparesis? Diabetic gastroparesis is broadly defined by abnormally slow emptying of solids and or nutrient liquids from the stomach to intestines in the absence of mechanical obstruction in a person with diabetes. Gastroparesis is a condition that affects the normal spontaneous movement of the muscles in your stomach. This may cause food to remain in your stomach longer rather than move into your small intestine to be digested. Now let us discuss about the symptoms of it. And they are nausea and vomiting, abdominal bloating, abdominal pain, a feeling of fullness after eating just a few bites, vomiting undigested food eaten a few hours earlier, acid reflux, changes in blood sugar levels, lack of appetite, stomach spasms, constipation, and weight loss and malnutrition. Now let us discuss about the causes. Vagus nerve is a nerve that controls the stomach muscles. It signals the muscles in your stomach to contract and push food into the small intestine. When the vagus nerve and its branches are damaged due to diabetes, it can't send signals normally to your stomach muscles. This may cause food to remain in your stomach longer rather than move into your small intestine to be digested. Now let us discuss about the complications. The first complication is malnutrition. Poor appetite means that you don't take in enough calories, or you may be unable to absorb enough nutrients due to nausea and vomiting. Next complication is severe dehydration. Ongoing vomiting can cause dehydration. Next complication is Bezoars. Undigested food in your stomach can harden and become solid mass called a bezoar. Bezoars may be life-threatening if they prevent food from passing into your small intestine. Next complication is unpredictable blood glucose changes. Sometimes the stomach of a person with gastroparesis may take a very long time to empty the food into the intestine, and other times the stomach may pass the food very quickly. This unpredictability makes it difficult for someone with diabetes to know when to take insulin, meaning their blood sugar levels may get too high or too low at times. Next complication is bacterial overgrowth. Food that stays in your stomach too long can spoil and lead to the growth of bacteria. Now let us discuss about the test. The first test is gastric emptying scintigraphy. This is the most common test used to diagnose gastroparesis. This test involves eating a light meal, often eggs and toast, that contains a small amount of radioactive material in it. A scanner that detects the movement of the radioactive material is placed over your abdomen to monitor the rate at which food leaves your stomach. A gastric emptying study may also be done using a liquid that contains the radioactive tracer instead of solid food. Next test is gastric emptying breath test. In this test, you'll eat a meal or drink a liquid that contains a type of protein that your body absorbs. The substance eventually passes into your breath. A provider will collect samples of your breath over a period of about 4 hours. The amount of the substance found in your breath samples can help show how fast the stomach has emptied. Next test is Smart Pill Wireless Motility Capsule. For the Smart Pill test, you swallow a pill-sized wireless electronic device. The device sends data to a receiver that you wear on your body as it travels through your digestive system. After 1 or 2 days, the smart pill will pass out of your body in your poop. You'll return the receiver to your healthcare provider who will read the data. Next test is barium X-ray. You drink a liquid called barium, which coats your esophagus, stomach, and small intestine and shows up on X-rays. This test is also known as an upper GI series or a barium swallow. Next test is imaging test. Imaging tests to rule out mechanical obstruction may include upper endoscopy, capsule endoscopy, upper GI series, CT scan, MRI, and abdominal ultrasound. Now let us discuss about the treatment. Medications to stimulate the stomach muscles. Metoclopramide, also known as Reglan, makes your stomach muscles to move, which helps food leave your system. It may also prevent nausea and vomiting. Erythromycin, an antibiotic, also helps your stomach to move food out. Domperidone. This medicine also increases the contraction of the muscles in the wall of your stomach and may improve gastric emptying. Antiemetics. Antiemetics are medicines that help relieve nausea and vomiting, such as ondansetron. Pain relievers will be given for significant stomach pain. Diabetes medications will be given to manage blood sugar levels. Next treatment option is the surgery, pyloroplasty. In this procedure, the pylorus is cut open and then sewn shut in a crosswise fashion so that it remains wide open, allowing food to pass through more easily. Next surgical option is gastric bypass. Some people may need to bypass the lower portion of their stomach completely if it is no longer functional. Next treatment is gastric electrical stimulation and pacing. In gastric electrical stimulation, a surgically implanted device provides electrical stimulation to the stomach muscles to move food more efficiently. Now let us discuss about the precautions. Eat frequent small meals that are low in fat and fiber. Fat, fiber and large meals can delay stomach emptying and worsen symptoms. Keep hydrated and as nutritionally fit as possible. If you have diabetes, maintain good glucose control. Avoid alcohol and smoking. Engage in regular physical activity. Lower intake of sugars and work with healthcare providers to improve blood glucose levels if consistently elevated.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.